When it comes to the doctors who are having a mixed week, let's say is more commonly going to happen in rural care, where a majority of their week they're doing that longitudinal family practice in their clinic, but then they're also doing, hospital rounds in the morning and then potentially some emergency shifts. Like, what are the pitfalls for a physician who's going to have to be using both systems, the PCPCM and the fee for service in a single day?
Well, one of the pitfalls in that situation, like you described, would be that they're going to have to be jumping back and forth between their two BA numbers, which could very easily get confused and billed under the wrong one. Very easily. Under the PCPCM, any of your long-term care or any of your hospital stuff would have to fully be just done under your fee-for-service billing, whereas in your clinical would be under your PCPCM. I do have a couple of clients that actually do a little bit of hospital billings, and in the first month that did happen. They actually switched them and we're billing under the opposite. So it's the EMRs, I have to say, have gotten a lot better since the announcement of the PCPCM with letting us toggle back and forth between the two BAs, which I know a lot of the doctors have been happy about. And they are always making advancements to the PCPCM. So for example, in the beginning, you couldn't bill an out-of-province healthcare patient under the PCPCM. It had to be billed under your fee-for-service BA. Within the first couple of months, they corrected that, so that way you would still be able to. So that way, mid-clinic, you're not jumping in between BAs or schedules. Because could you imagine what a mess that would be, having two schedules? That would be just insane. So they are slowly starting to figure out ways to be able to bill it under your PCPCM and making the proper adjustments.
Okay, right on. That makes a lot of sense. Yeah, having to manage multiple all at once, that would be a tall order.
That would be a nightmare. Plus, could you think of a clinic admin if all of a sudden now you're dealing with two BAs, two schedules for a doctor, and you've got 10 doctors in a clinic? That would be an administrative nightmare.